Good evening, Mr. Hughes. My name is Kate. I'm the nurse practitioner student here in the office, and I'm going to take a health history on you.
Sounds great.
Can you tell me why you're being seen in the office today?
I scheduled a routine physical.
Oh, great. Now, since you're new to the to our office here, I'm going to go through a lot of questions with you about your past medical history, family medical history, social history, all sorts of fun things.
Okay.
So let's start with your medical history. So what kind of medical problems do you have?
I was diagnosed with asthma when I was a kid,
Okay.
and it seems to be allergy induced.
Okay.
I have sleep apnea, and I've been using a CPAP for 9 years. I have migraines, vertigo, and a little bit of depression.
Okay. And can you talk to me about what medications you take on a daily basis?
Sure. I take my Advair twice a day, and that's for asthma. I have Zoloft. I take at night.
Okay.
And I have magnesium that I use for my migraines.
Okay. And do you happen to know the doses of your medications?
The Zoloft is 200.
Okay.
The magnesium is 500.
Okay.
And I don't remember what the Advair is. It has 2 numbers.
Okay. And it's one puff you take
One
twice
puff.
a day? Okay.
Correct, yep.
Great. All right, great. Have you had any hospitalizations in your history?
No hospitalizations.
How about any major injuries?
I've had broken bones when I was a teenager, but nothing since.
Okay, fair enough. And they didn't require hospitalization?
Nope, no surgery, no hospitalization for those.
Okay. And speaking of surgery, how about any surgical history? Surgeries you've had in the past?
I had a vasectomy after my last kid. That was in 2016.
Okay.
And my wisdom teeth probably in 2004.
Okay, fair enough. Neither of those required inpatient stays?
Nope, all outpatient.
All right, wonderful. And do you know if your immunizations are up to date?
Yes, they should be.
Okay, fair enough. Did you have a flu shot this past fall?
I had the flu shot this past fall, probably October.
Okay. And how about your COVID vaccines?
I've had 3 COVID vaccines, all Pfizer.
Okay.
And I had a pneumonia vaccine a couple years ago.
Oh, good, for your asthma. That's great.
Yeah.
Sure, that's wonderful. How about, is your tetanus up to date?
My tetanus is up to date. I think I had the last one after my second kid was born, so that was 2012. So I'm probably getting about due.
Okay, fair enough. All right, now how about allergies? That's the last part of this. Allergies?
Not that I know of.
Okay, great. Let's move to your family medical history. So this is a little bit in depth, so let's go piece by piece. Does your mom have any medical problems?
My mom has depression, chronic back pain, and fibromyalgia.
Okay. And how about your dad? What kind of medical problems does he have?
He has more. He had colon cancer. He has bladder cancer. And recently he had a pretty bad brain aneurysm.
Okay.
And I think that's it. Otherwise he has no health problems.
Okay, fair enough. Siblings? Do you have siblings?
I have one older sister.
Okay, how old is she?
She'd be 2 years older, so she's 39.
Okay, fair enough. And does she have any medical problems?
We're not close. I don't know much about her.
Okay, fair enough. And how about children? How many children do you have?
I have 4 kids.
Okay, do they have any medical problems?
Minor ones. My oldest has depression.
Okay.
I'm sorry, anxiety.
Anxiety, okay.
My second kid has Horner syndrome.
Okay.
My third kid had laryngomalacia and GERD as a baby, but he seems to have grown out of some of that. And my fourth kid, nothing so far, knock on wood.
Okay, fair enough. Grandparents. So let's start maternal grandparents. Do you know anything about them?
Maternal grandparents, yes. So my maternal grandfather had rheumatic heart disease requiring a transplant later in life.
Okay.
And he died of stroke-related complications.
Okay.
My maternal grandmother died of breast cancer when she was 38.
Oh, wow. Okay.
My paternal grandmother died of strokes, multiple strokes, and my paternal grandfather died of lung cancer.
Okay. Thank you for that.
Sure.
So let's talk a little about your social history. Can you tell me where do you live? An apartment, a house?
I own my own house.
Okay.
I live there with my wife and children.
Okay, fair enough. Anybody else living in your home?
Yeah, my dad with his brain aneurysms moved in recently.
Okay, fair enough. And what do you do for a living?
I run a small farm, small organic farm.
Lovely. Do you enjoy that work?
I do. It's very hard, but it's wonderful work.
Oh, great. So would you say you have a strong support system?
I do. My wife is there, and she is an equal contributor to everything, and we have family that live within an hour away, and they watch our kids, and we hang out with them routinely, and we have some friends that we hang out with.
Sure. Okay, great. How about religion? Do you practice any type of religion?
I don't. I just kind of no.
Okay, that's all right. Great. So let's talk about some of your health habits. Are you a smoker?
I am not a smoker.
Never smoked?
Maybe tried a cigarette here or there. in my
Okay,
life,
but never regular smoking.
Absolutely not.
Okay,
No.
fair enough. How about drinking? Alcohol, I mean.
Yeah, I drink probably 4 to 5 beers a week at most.
And is that like one beer a day? Is that like...
Yeah, it would be like 1 beer with dinner.
Okay.
A couple nights a week.
All right, fair enough. And how about any recreational drugs?
Never.
Okay. So stress management. It sounds like you have some stress in your life. You have a lot of children, and your dad's recently moved in with you. Do you have techniques that you use to manage your stress?
I try to find alone time.
Sounds like that might be difficult.
Easier than you'd think. Otherwise, I used to like to run, but I found I have less and less time for that. And then I've had some knee pain with running, but exercise.
Okay, great. That's good. And do you have a history of any sexual or domestic abuse?
I don't. Maybe a little, maybe from my mother.
Oh, as a child.
As a child.
Sexual abuse?
No, just more mental.
Oh, emotional. Okay,
Emotional.
fair enough. Okay. All right, thank you very much for that. Now we'll get going on to the physical exam.
Perfect.